Well, hello, and thank you for joining us today on HIPAA Chat, our monthly Q&A where we address your questions on HIPAA. I'm Carol Flag with High Tech Answers. We appreciate your time, and hopefully you're keeping cool somewhere. I'm in sunny Arizona where it's I don't know, brisk 117, I think. Today we're going to be talking about updated HHS OCR audit protocols for covered entities and BAs. HIPAA Chat, of course, is sponsored by eFax Corporate, a brand of J2 Cloud Services. Without their support, HIPAA Chat would not be possible, so we thank them diligently for their support. Please go online and check them out at enterprise.efax.com. They've got a number of products that deal with the secure transmission of ePHI and e-secure faxing. HIPAA Chat is also on LinkedIn. You can join our group and discuss HIPAA with us if you'd like. Just on LinkedIn, if you search for HIPAA Chat in the groups, you'll find it. You can also find YouTube videos of all our HIPAA Chats on YouTube on our channel, our High Tech Answers channel, and you can download podcasts on our radio station, healthcarenowradio.com, programs HIPAA Chat. Our hosts today from the Compliancy Group are Bob Grant, he's the Chief Strategy Officer of the Compliancy Group, and Mark Haskellson, the President. Pose your question on the right side of the dashboard with our experts, and with that, gentlemen, I'm going to turn it over to you, and have a great show.
Awesome. Thank you very much, Carol. So, Bob, and I think there's been some interesting trends that we've been seeing, so we figured before we get going and answering your questions, as Carol had said, we'll talk about some of the things that we're seeing in the market now that especially that after March 22nd release of the new Phase 2 audits. We've definitely been seeing some different things happening. And Bob, do you want to talk about some of the the specific audit requests that you've been seeing and how they've deviated from some of the stuff we've seen in the past?
Well, one of the things that I'm seeing from the audit protocols, and which is very interesting to me, is some of the things they're going to be asking for and how they're going to be asking for it. As people start to go through this processes right now, it seems like what they're doing is they're let's put it this way, they're signing you up for the potential to get audited, and then from that list of the people they're signing up, then they'll be asking for the audits. But they've kind of given you a nice little target plan for what you should be aware of when they come a-knocking. And one of the things that I found interesting too, Mark, was that when they asked for the Audit 2 protocols, where before they had said that they would have some arbitrarily on-site ones, I didn't see that this time. What I saw was that if you don't respond or you respond poorly, then they will have an on-site audit. I didn't see where they would go out and just do random on-sites. That's one thing that struck me as funny. So that's one thing to be happy about, hopefully. And the other thing is that having all your ducks in a row, making sure that your policies and procedures have the regulatory acts tied to them. So when you looked at the audit protocols, there was something they would say, for 164-508A, we're going to be looking for X, which makes me think that it'd be a lot easier for you as a covered entity or a business associate to have that in your policies. Or 164-306A, B, and C, if you're only a business associate and you have to comply with the HIPAA security rule. One of the funny things I see too, also, Mark, and you can weigh in on this, is that as a business associate, even though the rule says business associates only really have to comply with the HIPAA security rule, you have to be really careful with that, because if you're a business associate that is sharing information, there's going to be 5 or 6 privacy policies, maybe even up to 10, that you're also going to have in place, and it really depends on what you're doing for that covered entity. And so you have to really be aware of that situation through either your privacy security officer or the company that's helping you or the person that's helping you become compliant.
Yeah, another trend that I've noticed is, and I think the government has been saying this is coming, but I still think there is a large group of the market that isn't taking this as seriously as they should, is that we are now seeing, we've started to see business associates being audited. And you know, the ones that we've seen EHR providers, we've seen IT providers, we've seen some of the other non-traditional support services, let's say like lawyers and CPAs that have been added to the list. So it's definitely the warning we've been trying to say to folks is, you are going to get pulled into this. And one of the things that I think is a point that the government is, I don't think this is written anywhere, but I do think the concept of the connectors as being targeted is something that people should be cognizant of. And that they're looking for, to fix one covered entity's compliance weaknesses addresses what? Maybe let's say 10,000 patients. To fix a large provider, whether it's an EHR or an IT provider who has thousands of clients, therefore, what could be millions of actual patient records in there, I think is a juicier target. So I would be very careful, and that's some of the things we're seeing is just be, the way I've said it in some webinars is the friends you keep does matter now in HIPAA. So remember, under the phase 2 audits, there is a connectivity that says if the covered entity fails, they'll audit the BAs. If the BA fails, they'll audit their clients. So that that if you're a business associate servicing clients, don't just presume, hey, my client never asked me to sign a BA agreement, so I'm not going to worry about it. Or as a covered entity, if you are using a provider that has been dodging signing your BA, you really want to clean that up now, because once they start auditing you, and that unfortunately it's much too late. So.
Well, that's the first thing they're going to ask for. That's the first thing that's on the list. I want to see your business associates and your business associate contracts. First thing they're going to ask for. Why? No, that's up for debate. But I think one of the things is because business associates were brought into the game late, that they are going to concentrate a lot after this first wave of getting covered entities who have had many years, going on 11 years to comply, where the business associates are at, what, 5 or 6? So now it's much easier for them to assume that the business associates really maybe not are all at that point where they should be, and so maybe they're going to get more bang for their buck if they go that way, right? You remember this, they're not doing this for their health, right? They're not doing this to protect, they're spending money to, what, make money? They're spending money to do something. And so, and they're just, if you look at it, I get scared for business associates, and Mark's right about the business associate agreements. There's a couple different things that people should know about.
Did you just agree that I'm right about something? Holy mackerel.
I did.
In 11 years, I don't think you've ever agreed that I was ever right.
There's always come a time. There's a time and place for everything, right? There's one thing. There's one thing that
we recorded it. So.
One thing that Mark's right about is this. Business associate agreements are very important, and you should know that business associate agreements are not standard. Don't just take a business associate agreement that's sent to you and sign it. You don't know what the heck that thing is saying. Make sure your lawyer, if it's not something that your lawyer or that what you have is going to be a 50-50 handshake with this person, don't sign it, because now you're on the hook for whatever that says. It's a contract. So if it says that in that business associate agreement that you got and you just signed and sent back thinking that it was hunky-dory, what's going to happen is whatever that says, if that person breaches, and it says no matter what happens, you're going to breach. Hold on one second. If it says no matter what happens, you're going to pay for the breach, you're paying for the breach. You agreed to it. So make sure that you go back and look at those business associate agreements. Make sure that you review them, because you'll be surprised at some of the stuff you'll see in there, or some of the stuff you won't see in there, that making it not a compliant HIPAA agreement. So what I say all the time is this: your HIPAA business associate agreement should say this: if you breach, you pay; I breach, I pay. That's the only fair way about it. I hired you to do a service. If you don't provide that service and do it properly, you breach it, you're paying. It has nothing to do with me. If I breach, I'll pay. It has nothing to do with you. So you have to be really careful with it. That's my get off my soapbox now.
Hey, one trend, Bob, because you see this more directly than I do. Are you seeing more of the BA components, of the BA business agreement components being lumped into their general contracts, or more of a separation?
That's another one too. I think that's kind of, to me, that's just a sneaky way to do business. Is they put the business associate contract in there during contract time, and you're in there worrying about, what is the implementation schedule, and what is this going to, and what's that going to cost me, and what about this add-on, that on, and then there's a page in there that's a business associate agreement, and you kind of just, you're signing documents like you're signing documents for a car, right? Who reads that 9-page document when you go in for a car? You're kind of just flipping through saying, you're agreeing to it. Same thing happens there. So you have to be, when you're signing documents in a contract, be very careful. You're not signing away, what they're supposed to be doing for HIPAA, right? Who's going to pay and who's going to pay if there's a breach. So I see a lot of people, and all I can say to the people when they do that is, you're stuck. You're stuck until it comes time that this contract gets renewed, and then you can make a change. But you've already agreed to that for this year. You made that bed. You're about to lay in it. You signed it. You agreed to it. There's nothing you can do now. Can't turn back. So you have to be very careful when you're signing documents. I've seen it. I see it happen all the time, Mark.
Yeah, it's amazing, those trends. I think there are some times, though, and we, not to sound, doubling back, we have seen some instances where it was an appropriate addition, but unfortunately, as to Bob's point, a lot of times, we've seen more where we had to point out to our client that they really needed to modify that language because there are. By the way, the culprit, I think, by the way, often on this is from a trend is not that they were trying to be sneaky. One of the things I find is that a lot of times their contract lawyers really don't understand HIPAA. So what's happening is they're commenting on just traditional indemnification language. Mm-hmm. So often one of the other trends we've seen is a lot of, just like HIPAA's been heating up for, let's say, the general market, we've seen more legal counsel showing up in it, but often they don't particularly have a lot of healthcare expertise. So, I've been involved with a couple of calls where once I explained a little bit more of what the law required, they were very legitimately changed their language, but that you may need to kind of call that out in your discussions.
Well, I blame the government, right? I blame the government because they left it wide open to interpretation about something that's very critical to whether it's a business associate who has a business associate who has a business associate or a covered entity who has multiple business associates. They should have realized that there should have been set language into who's responsible for what. And the way they left it open and to just leave it open to interpretation by lawyers, that wasn't a good idea, in my opinion.
There are not too many occasions where I think leaving it open to the lawyers was ever a good opinion.
That's true. That's true.
And I like lawyers, but there are some times where they definitely go down the wrong path.
Well, they're protecting their customers, right? They're doing like we do. We protect our customers. I tell my customers, don't sign other people's business associate agreements. Don't do it unless your lawyer approves it, right? It's the same thing with them. The lawyer is writing the business associate agreement to protect their business associate. They're not writing it to protect you. So when you get it and you look at it, it's not there for your protection. It isn't. It's there for the customer's protection. So you have to be aware of that when you get them. Before when this business associate agreement came out 10 years ago, everybody was just, oh, okay, well, that's just a protection clause and this, and oh, yeah, I'll sign it. But it has morphed into way more than that now that audits are happening. And the more breaches that are found, and the more public news that it becomes, it could be detrimental to your business as a business associate or to your business as a covered entity. And who is responsible and who has to pay for it is very important. Anyway.
All right, so folks, we opened up with kind of some of the tips and some of the trends we're seeing, but now let me start taking questions. Please do, for those of you who are familiar with GoToWebinar, all you got to do is type them in on the right, and I'll do my best to feed them out to the crowd. So okay, so one of the first questions.
Before you get a question, I just want to make a point.
Please.
Here, okay? So this is in response to most people on here are probably business associates. And so I just want everybody to know, as a business associate, the only thing that, like I said before, you have to comply with the HIPAA security rule, okay? You have to have all of the protocols for the rules of security, with the policies, with the HIPAA 101 training, with the training for your staff, and it has to be in place, and you have to be able to show that you're doing that, just like a covered entity would. The only difference between you and a covered entity in most cases is you don't have to have privacy. You have to have privacy. You have to have somebody who's a compliance officer who does privacy in case you have a breach, but you don't have to have the privacy policy. So you don't have that 21 policies of uses and disclosures unless you're disclosing information. So there are set standards, set protocols in place for you already. You just have to get them in place to be able to be HIPAA compliant. Okay, Mark, go ahead.
All right, beautiful. Okay, so the first question we got was, we are a new BA and about to begin getting a BA agreement in place with a covered entity. Isn't it customary for the covered entity to get a BA to sign Isn't it customary for the covered entity to get a business associate to sign the covered entity's agreement and not the other way around?
Okay. That's interesting, right? So the business associate, right, the covered entity or the business associate needs to have a business associate agreement in place, okay? It doesn't say in the rule who's responsible. What it says is one must exist for you to conduct business together. So either the covered entity sends you one, and then you sign it, and if they don't send one, then you send one to them, because, and they may say at that point, oh, we have one already. Okay, great, we'll send it to me. But an agreement must exist between the two of you for EPHI to pass back and forth under the omnibus rule. It doesn't matter who, it just matters that there's one. And what I usually find is, as soon as one is presented, the other one comes up with one that they have. So, and if they don't, then they'll just sign yours.
So next one that came up is for a radiology group, which are service engineers, business associates. I am assuming no. They may have incidental viewing of patient data while servicing equipment. So should a confidentiality agreement be signed? What about sales reps who demo the product and use patient data in the demo and delete it when they have finished with the demo?
Ooh, that's dangerous.
Yeah, actually.
Okay. So
perhaps
here's the deal: if you buy an equipment and they come out and service it, and there's PHI on there, then you need a business associate agreement with that person, with that vendor. Okay, that way, because especially if they're coming out to your site to service it and they're not accessing it online, right? They can't access it online. There's no way that they can log into the system and make certain changes online. Well, then you could just do a confidentiality agreement with the person that comes there to your office, right? HIPAA confidentiality agreements, you can get those, and those are for people like, so for everybody that doesn't know what a confidentiality agreement is, it's for people that come on site, like the copy guy, the fax guy, the building maintenance, cleaning services, people who you hire to come on site. You didn't hire them to work with PHI, but they're doing some service for you where they may see it, hear it, or touch it. You're going to want to HIPAA confidentiality agreement in place with them. So in the instance that you're talking about where they're coming on site to do it, then yes, you can just get a HIPAA confidentiality agreement with each individual, not with the company, because that's not what they're doing. It's each individual that comes on site. You would have them sign it when they come to the front desk and they're coming in. Now, if they've already signed one, you could say, oh, you've already signed one, and you can go ahead and work on it. But if they're accessing it over electronically to fix it, then you're going to need a business associate agreement with that company. Difference. Okay? So that one is that. And what was the other one? What was the other side of that, Mark?
They were running a demo, and then after the demo, they deleted it.
Just because you delete it doesn't mean it's still not there. So,
I would say in general,
it's still not there. I wouldn't allow them to do. You should not allow people to do live demos of people's information at all.
Yeah, if at all possible. Yeah, most organizations have demo accounts or some sort of fake ID, fake personalities that exist in their systems.
Yeah, that one's not acceptable at all.
Yeah, that one I'd stay away from.
Yeah.
Let's see. So next one. If an organization is a de facto business associate but hasn't designated as such by the covered entity they support, to what extent will OCR hold them accountable for the BA requirements?
Okay, let's break that one down. Right? So how can you be a de facto business associate?
While you're thinking about that one, the way Omnibus was the language of Omnibus, okay, BAs have always existed, folks. It's always been in HIPAA language, the concept of business associate. Omnibus specifically said you cannot share PHI with another party, okay, in this case a business associate, unless you have a BA agreement in place. Okay, so they gave us technically a year from September 2013 to September 2014 to clean up the mess, but as of that point, if you are sharing in any way PHI, it's not, often we hear business associates will say to us, we don't think we have to be HIPAA compliant because our client didn't ask us. It's not true. You need to be, you are a business associate under the law. So don't presume it's what, in many ways, my counsel to both the BAs and covered entities involved is, a BA agreement is just a really good defining of where the liability begins and ends. Okay, so it's good for both parties. It should not be an uncomfortable issue, right? I realize that lawyers can sometimes weigh in and make these things more complicated, but as Bob had said earlier, what really should be the crux of it is we both agree we fall under HIPAA as a law, and that if I'm responsible for what I do and you're responsible for what you do.
Yeah, if they're sharing information, if they shared information with this company, they're a business associate. There's no de facto to it.
Period. Yeah.
Yeah, it's period. It's if you receive the information, you're a business associate, and you should have had business associate agreements in place, and you should be complying with the HIPAA security rule. Simple.
All right, so let's take well, I'm sorry, I didn't mean to cut you off, Bob. The couple of easy ones that I've seen here. So and this is a clever one, I think this is the chicken or egg question. If a BA agreement is separate from the contract, which document is processed first?
Of course, the contract is, because data hasn't passed yet. So the contract goes first, and then the business associate agreement can come second. So if you're signing, you got to sign up first, and then data, and then you have the business associate agreement, and then the data passes, right? So the contract's always first.
Yeah, which you might have. What we do see a lot of folks is non-disclosure agreements, confidentiality agreements being exchanged before they get into contracting. That's probably more prominent. And then definitely with existing relationships, your contract may, let's say, have an termination or evergreen clauses. But either way, your business associate agreement is something that once you've signed it once, although you have to review it every year, you don't have to re-sign it every year. So keeping them separate and the timing of them can be more complicated. So let's see. Okay. Have a, I'm sorry, Bob, did you have something or no?
No, no.
Okay. If you have a, I'm not going to read this, it's a little bit strange. With a BA client, when drafting policies and procedures, how do you handle the regs that don't apply to the business associates? Do you just skip them entirely?
That's a good one. And so on the security side, they all apply. How can they not? Right? And so there may be a part of the regulation of the part of a regulation that you may not be doing or have to do, and you can just leave it out. That or you can make a comment in the policy, right? But when you look at the policies for HIPAA under security, and you're a business associate, you have to secure that data. There is no pick and choose, right? You don't get to pick and choose what you want to do. You have to do it all. You have to I can go through the whole list, right, of what you have to do, but if you look at the HIPAA security rule, you have to do it all, and you have to have policies backing up that you're doing it all. So the regulation says, regulation says this, 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 and this, and your policy says this, this, and this that corresponds back to that regulation. And then you're going to train your staff that this is how we're going to do this now. We are going to change. That's the hardest thing for healthcare, and the hardest thing for business associates is to change. You have to change the way you're doing things. Well, we've been doing it this way for 6 years. Well, I'm sorry, that doesn't work anymore. You're going to have to do it a different way now. You're going to have to, well, we don't want to change passwords every 30. Well, I'm sorry, but that's what the rule says. You can, here's the deal is, this is a free country and a free world. You can do whatever you want, but if you get audited and you're not doing what the people from the auditors come out and look at, you're going to get fined. There's nothing I could do. There's nothing we could talk to her blue in the face about it, but the rule is specific. It's not. No, let me back up here. The rule is semi-specific to what they want, right? The rule says you have to periodically do something. And everybody says, well, the rule says I periodically can do it, so I'm going to change my passwords once a year. Yeah. But the government runs off of ISO and NIST, and ISO and NIST says that it can be no longer than 30 days, or 6 months. So you've got other agencies, the International Standards Organization and the National Institute for Standards, you've got technology, you've got these companies over here that have the ear of the government, and they're telling them that this is what you should look for when you do an audit. And so the rule, even though the rule is not specific to what it is, the government does the audits based off of what these organizations are telling you to do. So that's why when you look at a policy, it says once a quarter, everybody should have their passwords should be changed that are accessing, let's say, an EHR. And that password should be 8 characters long with a special and a capital. Well, I can't be doing that and changing that all the time because my people won't remember their passwords, and that's going to mean more work for me. Well, the government don't care. They don't care if that's going to be more work for you. But if they come in and find out your passwords haven't been changed in a year, you can expect to get dinged for it. So your policies dictate what you do, not you. You don't dictate what the policies say if you want to be HIPAA compliant. All right? Okay.
So, interesting question, which is, we see this a lot. Does our EHR vendor have to do security risk assessments each year, or do they only have to do so if our BAA states they have to?
The EHR company is responsible for doing their own risk analysis. They don't do one for you. You have to do yours. Right? Am I getting that right?
Well, no, and Bob, a lot of people misunderstand this. You're not responsible for your BA's HIPAA compliance, okay? They need to be HIPAA compliant because the law says they have to be HIPAA compliant. Your obligation, whether it's a covered entity outsourcing to a BA or a BA outsourcing to a to another BA, a subcontractor, in the end, what the government is saying is you must do two things. One, you must have a BA agreement that clearly outlines the responsibilities and liabilities. And then two, you have to verify or do your due diligence that this organization can support you in the protection of this information. And this is why what Bob was saying in regards to, although BAs inherently do not have to satisfy the privacy rule, they must satisfy the security rule, often they are called for in the service they provide to help whoever was outsourcing the information, in this case the covered entity. They're often part of the solution is them being able to help protect the privacy of the patient's information. And that's why it gets a little bit thorny. But without a doubt, you don't have to be, let's say, calling out those specifics in your BA agreement. They need to be HIPAA compliant because they need to be HIPAA compliant. This goes back to, we hear this a lot where, we've seen organizations, well, we're not going to worry about this because the client didn't ask us to. Unfortunately, I've seen this on both sides. If you look at, let's say, SSS, which is the insurance company in Puerto Rico at $3.5 million in fines, one of the big areas was for failing to have BA agreements in place. Now, by the way, in that case, they were actually a covered entity as an insurance company. Okay, if you look at the situation that happened in April was one of the North Memorial, I think was the organization. Their ding for 1.5 was they had an ongoing relationship with a billing company that they never had a BA agreement in place with. Okay, so they are definitely looking to fix these gaps. Is the best way I can explain it. The trend is what we were seeing. But no, you are not responsible. They're responsible for their own HIPAA compliance. You're just responsible for making sure that you have an agreement in place that says protects appropriately and that you have done your due diligence. Another example we've seen was, well, it's my nephew who's doing billing for me out of his basement. He signed the BA agreement, so therefore isn't it okay? No, you know that person can't adequately protect the PHI. They've not satisfied HIPAA. You are negligent if you let them do work for you. So let's give another good question. Ooh. The person who just sent a question in, could you resend that? I accidentally moved it and deleted it. It was a question about the definition of a business associate, so if you can send that back in again. Oh. I didn't see the rest of it, so I apologize. So next question. We deal with purchase orders from many hospitals for our spine surgery products. How much patient info are we allowed to share with the hospital to fulfill the purchase orders without violating HIPAA? And do we have to have BA agreements with all the hospitals?
One more time, Mark.
Okay. So they are selling equipment to a hospital.
Okay.
In that exchange, they're exchanging patient information. So they want to know how much information can they be exchanging with them without violating HIPAA, and then do they have to have a business associate agreement with the hospitals?
So basically, they're a durable goods vendor, and so, for example, maybe they're selling. I'm going to make an assumption here. You're selling, let's say, casts, or you're selling whatever it is, crutches, right? And so you need to know the size of the crutch and the person's name and this and that to fulfill the order. Well, and for that is under HIPAA, you're allowed to share that information under TPO for durable goods. Okay, so durable goods do not fall. That's not a business associate. It's unless there's something else involved with the TPO, like they're sending you billing information and things like that. So the hospital can share information, or you can share information with the hospital to get the information necessary to create the durable goods. So durable goods it's kind of like an operational thing, right? Because, look, the rule's not there to prevent the even flow of information back and forth to treat the patients. That's not what it's there for, right? It's there for you to protect the information once you have it. So, they made some good decisions when it came to, durable goods vendors, and so my thing is like eyeglasses, right? So if it's for treatment for treatment, so that's for treatment if you think about it, right? Being a durable goods vendor, that falls under treatment, right? So that information could pass back and forth, to get the necessary information in place for the patient, right? But don't think that you're going to, utilize this treatment all the time to get around HIPAA, because it doesn't work that way, right? This is a specific issue about being able to transfer information back and forth to benefit the patient.
Okay. So let me, the questions that were asked, and a couple of people kind of, I guess on me saying that, have prompted more questions of this. So they were saying, the person said, I'm struggling with the definition of a business associate. Would the outside company we hire for IT services be a business associate? And what about our after-hours call service? And Bob, let me kind of talk about this. One of the best ways, and actually it was a guy named Frank Ruiz who came up with this statement. He's an interesting guy in the world of compliance. One of the easiest ways to do this, okay, is use a simple question, okay? What is this company, XYZ company, doing with my PHI that I would have done myself, okay? So in the case of an IT vendor, they are servicing your computers. They're maintaining your virus protection. They're doing remote maintenance. There's a lot of things that they're doing where, because of that, they have access to your PHI. So they are absolutely a business associate underneath the law. Same thing, let's take this answering service. What is this answering service, XYZ company, doing with my PHI that I would have done myself? They're answering the phone, asking the patient to explain what the issue is, clearly getting into the PHI category. Then they're taking that information and conveying it to the doctor. Okay? So in both of these cases, they're BAs because they are the only exception that, or I'm sorry, there are some exceptions. One that is often confusing for folks is somebody who's considered a conduit. Okay? So Verizon Telecom, Verizon Wireless, is not inherently a BA because they are transferring, you're using them to make phone calls. But if they're also providing answering service features for you, now they're a BA. Okay, because that is something you would have done yourself. You would not have built your own telephone company. Okay, so I don't know if that helps. There's a couple of questions that were revolving around that. Bob, I don't, if you have stuff you want to add to that, we see this a lot with people grappling with this.
There's an easier way to decide if they're a business associate agreement or not, right? If you hire a company, meaning you physically pay them money to do something for you, and involves you either sharing directly with them protected health information or giving them access to it, they're a business associate. So much easier to think about it that way. Oh, I hired this company. Oh, we're going to give them access to the business associate. Oh, it's shredded and they're going to come and we're going to directly give them the PHI to shred. Business associate. I don't care if they're shredding it at the front, right outside their front door. That doesn't affect me. It affects me that you're taking it out and you're opening it up out in the street and it's sitting right there open. I don't care. That's a business associate. I'm sharing it directly or I give them access to it. Yes.
One question that came up, and this is a fair one because we've been using a lot of acronyms. The question was define PHI.
PHI. So PHI is protected health information, and you can look this up online anywhere. There are according to HHS, there are 18 fields of protected health information that you must protect at all times. It doesn't say, well, so if you have a name and you have zip codes and you have whatever it is on there, and someone can directly identify who this person is by that information, that's protected health information. I've seen it all the way down to in a small area that you have the first and last name, and that's protected health information. So there's 18 fields of protected health information, or PHI, and you either have it on paper or you have it electronic, which makes it ePHI, right? And you must protect that.
Okay, so this is another deep one. Is an on-site or environmental assessment required for HIPAA? If so, where is it stated in the HIPAA standards? How can all of the online HIPAA companies get around this if it is required?
Okay, so the rule is this. You must address, for the HIPAA privacy and security, you must address administrative, technical, well, let's just do security. Administrative, technical, and physical. Okay? The administrative side is the policies and procedures you have in place covering all aspects of the rule. The technical side is the evaluation of your systems, devices, laptops, desktops, phones, any place that you're storing information. It could be CD-ROMs, jump drives, backup tapes, all of that, servers, all of that is under the technical side. And then the physical side is the physical walkthrough of your location, making sure that the doors are right, making sure your server room is protected, making sure, all that type of stuff, the physical side. Now, nowhere in the rule does it say you have to have somebody from the outside do it. It says you have to have, a third-party evaluation, right? But that could be a simple third-party evaluation, or it could be a full-blown one. But the rule says that you can do a self-audit. You can do a self-audit that covers all the parts of the regulation, and you can track that. The one thing that the government looks for is that you have a compliance plan in place. They want to know that you're doing this consistently every year. There's no way that these EHR companies and stuff are not doing that every year. Because they're the first ones that are going to be on the hook for something. If they have a breach, they're going to need to show that documentation to be able to get out of being fined for that breach. The only reason that you get fined for something under HIPAA is if you're in willful neglect, right? You can get your fine could be $100 if you can show that you made a good faith effort and you had all the policies and procedures in place, all your staff was trained, all your audits were done, all your remediation was completed, and you have a plan and you're doing it every year. Well, you're making a good faith effort. And if some rogue person from your employment does something really dumb and sends something out and it gets you in trouble, you can show that you were doing everything you possibly could. I'm not going to say you're not going to get fined, some money, but it's not going to be in the millions like Mark is talking about, because that's just flat out willful neglect. I don't know anything about my business associates. I was supposed to have agreements with them. Well, guess what? You're going to get fined. But if you the rule says you need to make a good faith effort. It doesn't say you have to be 100% compliant. But guess what? Because you know why? You can't be 100% compliant. Why? Because things change. Your systems change. Your people change. Healthcare is set up to be breached. We fax, we mail, we email, we do all sorts of things that just set us up for it. But you have to have that plan in place. Okay.
All right, so I'm going to consolidate a couple of questions, Bob, and they're primarily around cleaning services. So you might want to, could you take a few minutes and talk about non-BAs in general?
Sure. Okay, so non-BAs, right? So those are the people that you hire. Now here, okay, so remember my statement about you're a BA if I pay you and I give you access to or I share PHI with, right? You get a confidentiality agreement is if I hire you to do something and that something has nothing to do with PHI, but you may see it, hear it, or touch it. Confidentiality agreements, right? So for example, this is a good one about cleaning services. So if your office has just got PHI spread all over it and you have a cleaning service, are you really showing due diligence and protecting those people's data by leaving it all out? No. So you should have a clean desk policy that everything is cleaned before everybody goes home as well as you can and put away so that when the cleaning service is in there, they're not, 4 people are sitting there while one guy is cleaning and they're all looking through people's charts. Don't think it doesn't happen, because it does, right? So you need to think that when you're cleaning, when you're not there and your cleaning service is there, you need to have confidentiality agreements in place with them. So that's the same thing with the copy guy, right? unless your copy machine has a hard drive in it. There's another thing. I think I mentioned this last week, right? If you've got copy machines that you leased and you've got hard drives in them, you best make sure you take that hard drive out before it leaves. I don't care if they say, oh, we don't store data on there, there's nothing on there. I saw somebody get fined $800,000 for it because they took, the printer got leased, got taken back to the leasing company. The leasing company, they leased it again, and somebody saw the PHI on there, reported them to HHS, $800,000. Don't care. Open the printer up, give me that hard drive. I'll pay the $30 for a new hard drive for it. Get that hard drive and destroy it. Right? Any computer system, anything that goes out. That's got off the subject here. But the thing about it is, anybody that's accessing your site that you didn't hire to work with PHI, you should get a confidentiality agreement. Unless it's people like the water guy. The water guy walks in, he puts the water in, he leaves. Right? The mailman comes to the front desk. He doesn't need one. He didn't come in the back. Right? Now, the FedEx guy comes and he's walking around, or the sales guy. How about this one? How about your sales guys? How about them? They're buying lunch for you, right? And you're all sitting on the desk, and he's sitting on the desk, and PHI is there, and the phones are ringing, and patients, and he's seeing and hearing everything, right? Confidentiality agreement, right? If you're not allowed to sign one, well, then you wait out in the lobby. And when you waited in the lobby, and when the doctor gets a chance, he'll come out to see you. Well, guess what? Doctor's never going to have a chance to come out and see you, so he's not going to. So that guy's not going to be able to see the doctor, right? You have to make hard decisions that to protect your practice and your hospital and your clinic and your business associate. Make hard decisions. Sorry, you don't want to do this and you don't want to follow our rules, you can't come in. Okay. Off my soapbox again.
We love your soapbox. This one is a multi-part question, but I'm going to just pull out the part that I think is important. Okay? Right. So the question was, does the definition of a business associate require the covered entity to pay the BA? Okay? But their question was, would a consultant reviewing information containing PHI for a covered entity, whether it was for no cost or cost, be a BA?
Yes.
Okay.
In most instances, you're paying the consultant, right? Right. Yeah. Unless he's a friend of yours and he's coming in and looking at your compliance plan or looking at something, then yeah. Now if it's a doctor, then no, right? Because that's treatment. But if you have a consultant in there and they're consulting you on your HIPAA plan, or they're consulting you on something else and they're looking at patient information, then yeah, you'd have a confidentiality agreement in place.
So now let me we're coming up on the hour, and there's a couple of good questions in here that I think are the crowd may find interesting. And this one was, we were told that if we consider a contractor a workforce member, that they can be excluded from being a business associate. Is that true?
That's a good, okay, so I'm going to step back a little bit here, because that's kind of like what we do. So if you have and this is a contractor, right? He's contracted to come in and do, let's say, privacy work for you, or whatever they're doing for you. But they're a consultant, right? And they're a personal consultant. They don't belong to any company or anything like that. Well, you know what? That person's not going to have privacy. They're not going to have security policies and all the things that they need to fall under a business associate. So guess what? They're not really a business associate. And you're actually giving them access to PHI to do whatever consulting work they're doing for you. So actually, under the rule, they're kind of a business associate. They're kind of not. They're not really a company. So how do you get around that? This is good for students too, right? For people who have students that come and work for you. How do I get around that? Well, number one, this is how you do it. You get them to sign a confidentiality agreement, and they go through every bit of training your employees do. So you kind of treat them but you don't want to treat them, you don't want to tell them they're an employee, right? We're gonna have you go through this training, and we're gonna have you sign this confidentiality agreement. Now you've got proof that they understand everything that you do, So they're kind of an employee, but they're not an employee. They're kind of a business associate, but they're not, but you've got yourself covered.
You might have more trouble with the Department of Labor about 1099 employees, but that's a different problem.
Yeah, that's
Okay.
a whole different story, right? Yeah.
Okay, so this is an interesting one that has come up recently. Okay, so with Microsoft 365, does one business associate cover cover several agencies under one umbrella, or does each agency need to have a BA with Microsoft?
No, you just have to have, each agency.
Yeah.
One more time again?
All right, so
Microsoft 365, they have a contract with them.
does one BA, business associate agreement, cover several agencies under one umbrella? So are you asking, for example, you have 365?
Yeah, you could have it under the main umbrella, right? So if you could have a trickle-down effect, right? So you would, so let's say you have a compliance plan, you have a main location, and then you have these satellite locations. So you would have, it would be stored at the main location and also at the satellite location, the same business associate agreement. So you can show that you do have a business associate agreement with Microsoft. But you could have it signed by your main. If you're all tied under one umbrella, you're all covered under that one BA. There's no reason to have it for each one. That's way too much work.
All right.
I do that all the time. I have the main site. I actually have, when I have multiple locations, I have the main site take care of all the business associates and take care of all of the training. And then the other sites have to do all the policy and procedure work and the audits and things like that and remediate them for each individual site. But I have the main site control all the rest. Just makes it a lot easier for the privacy and security officer.
So here's another one that I've not seen quite this way before. Does the covered entity need to have a copy of the agreements a business associate may have with the parties hired by the BA, so the subcontractors?
No, not your job. Not your job. You do not have anything to do with that. That's the BA's job to have BAs with their BAs. Not your job. Your job stops at that BA. Then that's BA's job to get the next BA and the BA, and so it's a chain. It's a long chain. And if the guy at the end of the chain breaches, he tells the person in front of them, who tells the person in front of them, who tells the person, eventually it gets back to you that, guess what, 7 BAs down the road, your data got breached. So that's how that works. It's a chain kind of thing. So you're only going to know if the business associate agreement that you're directly sharing information with, but that guy is going to know eventually that the data got breached because it's in the business associate agreement that that's supposed to happen. So you do not have to worry about anybody after the one that's directly involved with you.
All right, so we have just a couple minutes left. I'm trying to find you a question that we'll okay, this is a good one. Will a covered entity providing telemedicine services to another covered entity considered a business associate of that covered entity receiving the services?
No, it's treatment.
But I have a question. Is the software provider?
The software provider is a BA, right?
Okay.
Because they're probably storing those meetings, okay? So if they're not, if it's a direct connect through that makes that company a conduit, right? But the information that's passing from covered entity to covered entity is treatment. So the person, the in-between person, depending on what they're doing, so I don't know what they're doing, right? Are they storing it? Are they on the line with it? Whatever, right? The company in the middle may be a business associate, but the two entities on the end, you're having this telemedicine for treatment, then no, that's covered under the rule. You can do that.
Cool. All right, so we're coming up on the hour. What we'll do, the questions we did not get to, we will try to, if they were not answered for you, because a lot of questions were similar about some of the questions about BAs and the interaction between covered entities, do feel free to reach out to either Bob or I. Our pleasure. We'll get back to you with whatever the answer you need. We really do appreciate J2 Global and EFAX for being kind enough to sponsor this HIPAA chat. I know Bob and I, it's kind of fun for us because we get all these questions all day long, and we're hoping that the more time we spend with you folks, that you will be more knowledgeable in the market, and therefore overall compliance, or let's say HIPAA, will be improved. Because in the end, I really do think if we do a better job as an industry, that hopefully HIPAA will be less of an enforcement hassle for everybody in the future. But Carol, thank you very much for coordinating this all for us. And oh, there you are. You're back.
Oh, I'm back. Yeah, I'm back. Yes. No, thank you, Mark. Thank you, Bob, and of course, thank you to the audience for taking time out today to show up. We appreciate it. We'll of course be back next month with another HIPAA chat. And you guys stay cool wherever you are, and I'll talk to you later.
Thank you very much.
Bye, guys.
Bye now.
Bye-bye.